March 10th, 2020 was the day COVID-19 turned our lives upside down. But thankfully, March 10th, 2021 was the day we got hope that the pandemic will end. With the COVID-19 vaccine now being available to Jamaicans across the island, it means that very soon we can get back to normal. These vaccines are both safe and effective and will ensure that you and your loved ones are protected and can get back to the things you love most, like partying, going to church, like family dinners, like simply giving your mom or dad a hug. I have been vaccinated and I am encouraging each and every Jamaican to take the vaccine when it is available to your group. Let us put a stop to the COVID-19 pandemic. Let us get vaccinated so we can get back to life.
If ever there was a time to take care of your mental health, it is now.
Now, when your physical health so clearly impacts your emotional health.
Now, when we need to talk and listen to each other.
Now, when supporting each other means survival.
Now, in a time of COVID-19.
Speak up.
Speak now.
Beat COVID-19.
Call 888-NEW-LIFE. 639-5433.
Good morning, ladies and gentlemen, members of the media. Thank you so much for joining us for the Ministry of Health and Wellness's COVID Conversations for Thursday, April 1, 2021. The Minister of Health and Wellness, Dr. the Honorable Christopher Tufton, is joined by the Permanent Secretary in the Ministry, Mr. Dunstan Bryan, as well as the Chief Medical Officer of Jamaica, Dr. Jacqueline Biseso McKenzie. And we also have with us the Director of Family Health Services, Dr. Melody Ennis. We'll begin this morning's conversation with the update from the Minister.
Thank you very much, Stephen, and good morning, everyone, and good morning to the team who are here, PS and the CMO, and of course the technical team. Let me wish you a holy and peaceful season. Today, the 1st of April, a long weekend, an important weekend or important few days on the Christian calendar. And so I want to just recognize the significance of the season, the significance of the next few days. Rather unusual this time around because of the restrictions that have been announced in protection of all of us as a critical part of the COVID response. So I greet you in the spirit of the season. I encourage us to spend the downtime, if you will, the quiet time, to reflect on humanity, on self, on our responsibilities as a people, to ourselves, to our families, to our community, and indeed to our country and to the world at large. I think the world is experiencing unusual times. And we must spend the time also to think about those who have left us as a consequence of COVID-19, the loss, the grief associated with that loss, and those who are suffering where we can reach out. I certainly would like to invite us so to do. There are others who are restricted by movement, particularly our senior citizens who have had to stay at home, stay indoors, and who, for that restriction, would have had challenges in terms of their mental state, in terms of their physical state. I encourage us to use this weekend and the significance of the season to reach out to someone, a neighbor, a friend, a relative, someone you don't know, but you know they're experiencing those challenges. Let us be our brother's keeper because at this point, more than ever, we need it. So today, at this time, we are going to continue to give you the updates around our COVID response as part of our COVID conversation. And I welcome those who are online, even while I greet you in the spirit of the season. So we're going to begin by asking the Chief Medical Officer, as usual, to go through the surveillance update to give us a picture as to the state of COVID in the population at this time. CMO.
Hi, good morning, everyone. This update is with data as of 4 p.m. on the 31st of March, which was yesterday. Next slide. So we would have confirmed 306 cases, new cases yesterday, which would have brought our total to 39,543 persons confirmed with COVID-19 since March 10th last year. Of those, we have 790 imported cases and 38,753 cases that were locally acquired. Unfortunately, we've had 599 deaths, which it works out to be a 1.5% case fatality rate with 21.9 per 100,000 population. And if we take out the imported cases, 21.5 per 100,000 population. So this brings our daily positivity rate yesterday to 30.1%, and our cumulative positivity rate, that is the positivity rate, the overall numbers and the overall positives since the 10th of March last year, to 13.9%. Next slide. So again, just to show each time we present the age distribution, again to highlight the areas where we're having the largest numbers. And this is a 20 to 29 age group and a 30 to 39 age group, where we have 19.5% and 19% respectively of persons that are confirmed fall into these age groups. Again, this is where we're having, therefore, the highest risk of exposure. And these persons, we really would want to ensure that the precautions are being kept there. But we also want to point out that the 30 to 39 and 40 to 49 and 50 to 59 age groups are also the next areas where we're having a high degree of exposure and confirmed cases. Next slide. However, this is different from, again, the number of the areas where we're seeing the deaths in terms of the age groups, because the 60 to 69 age group and over are where we're having the highest percentage of deaths. If you look, 132 in the 60 to 69, 147 in the 70 to 79, 115 in the 80 to 89, certainly where we're having the highest number of deaths and the highest case fatality rate. Next. This gives us an idea across the parishes what is happening now. Over the last 2 weeks, we would have confirmed 4,915 cases. For those persons that are tracking, you would have recognized at our last press conference last week, we would have had over 6,000 active cases in the preceding 2-week period. So we do see a small fall here in terms of the number of cases that have been confirmed over the last 2 weeks. Next slide. And essentially, when we look at the communities that are affected over the last 2 weeks, we will see that the majority of communities, there's a great percentage of communities that are affected in each parish right across the country. This is what our epidemiological curve looks like in blue, where we will see that the 8th of March, we see what looks like a peak. It is too early to say really that we are going down into terms of the number of cases. What it appears is that we may have reached a plateau. If you recall, and if you look at the curve, when we had a peak in August last year, you would recognize that we were at a plateau for about a month, 4 to 6 weeks, we were at a plateau. So right now we see it may be similar, we can't tell. With the increased restrictions, we're hoping that we will shorten that period. But certainly we don't think that there is a downward trend yet, but possibly a plateauing in the number of cases. Here we look at the burden by week of the COVID-19 cases, and does follow the same trend in terms of an upward trend and what appears to be a plateauing of cases over the last 2 weeks or so. In terms of bed occupancy, we will see that in the blue line that the bed occupancy is follows the positivity rate, which is in green. We can see the positivity rate has gone up and is plateauing, and the bed occupancy and the deaths are following that same trend. This is a graph that looks at our reproductive rate. You would recall early in February, we would have had an estimated reproductive rate at 1.3. At that time, we would have introduced the increased curfew hours on February the 8th, put in place February the 10th, and then we would have introduced increased gathering restrictions on February the 24th. Now, following that, we would have seen a decrease in our reproductive rate. The last time we had a press conference, we had reported a 1.1 reproductive rate. And then now we're reporting that over the last 2-week period, approximately at about the 18th of March, an estimated reproductive rate of 1.0. So we would have seen a fall in the reproductive rate, and we believe that this is coming out of the increased restrictions that we would have put in place that would have decreased the risk of exposure, decreased the movement somewhat of persons, and have brought down the reproductive rate. Now, in terms of what the projections are looking at this reproductive rate, if we are at a reproductive rate of 1 now, and we are reporting 306 cases and an approximately 30% positivity rate, what it means is that if our reproductive rate remains at 1, then we will probably see the same number of cases being reported for the next couple of days, maybe going into a couple of weeks. What we would like to see, however, is a drop in the reproductive rate. And this is what we are expecting coming out of the further increase in restrictions that have been put in place and the weekend restrictions, that we would accelerate that drop in reproductive rate, because we really don't have the time to wait for it to slowly to come down, because as we would have reported, our hospitalizations are still quite high and our admissions rate are still quite high. So if it is that we can bring down our reproductive rate to 0.9, 0.8 in a short time, then we would be expecting to see a decrease in the positivity rate and a decrease in the overall numbers of persons being positive and being admitted to hospital on a daily basis. This is what our bed situation looks like presently and over the period from the 10th of March. The red line indicates the number of beds that have been allocated for COVID care, and we would have seen that over time we have gradually increased our capacity. We are now at a capacity where we have approximately 600 beds that are dedicated COVID beds. What we would see in the blue is that we have gone over that in terms of hospitalizations on a daily basis for the last couple of days, probably about 2 to 3 weeks. We would see that our numbers in terms of actual persons on beds are more in the region of about 700. Now, we saw that we had a little bit of peak about the same time in early March, and we have come down a little bit. But our hope is that this will continue to decrease with decreased exposure in the population. In terms of the admissions, we have seen that the admissions in the orange line have gradually increased over time, and now very, very early we are seeing a slight decrease in the admissions over this week compared to last week. And this is a trend that we're hoping will continue. In terms of our positivity rates, we would have seen that this week our positivity rates are a little bit lower than last week. These are certainly positive signs that we are seeing that our admissions are going down. We are seeing that our positivity rate is going down a little bit. And what we, at this period now where we have increased the restrictions, we're hoping that we can bring this down quickly to get it under the capacity of our health system to be able to respond. Next slide. I put this slide back again just to show that in August last year we had a triggering activity in terms of the holiday week and the events that followed, and this resulted in a spike in the number of cases. Right now, in this long holiday weekend, we are at a considerable risk of increased exposure if the number of persons on the road and in the shopping areas, in the recreation areas increase. We face the risk that we could have, this could be a triggering weekend with the result that in another 2 to 4 weeks we would see our numbers going up. And so it is very, very important at this time when we are seeing the numbers starting to trend down, that this weekend in particular, people stay at home, people reduce their hours out on the road, reduce their going into any kind of crowded situation, wear their mask, keep physically distanced from others, and if you are sick, stay at home. Protect your vulnerable persons, because this weekend could be a turning point for us in the wrong direction if it is that we have a large number of exposures going over this Thursday today, going up until Monday next week. I'll end here, Minister.
Thank you very much, CMO. I just want to use the opportunity to thank the team that allows us to have this kind of data, starting with the raw numbers that is collected in the field. You know, sometimes we take for granted that this is available to us, and it helps us to make decisions and to help the public to understand what is happening. I just want to say that there are literally hundreds of persons, public health team members who are in the field from the level of the health center, actually from the level of homes in some instances, the public health nurse and others who collect the information, who log the information, who upload the information into a central repository. And of course, from there, our epidemiologist and her team, Dr. Webster Carr, will take it and put it into a format that is understandable. And persons like the CMO and others interpret and then explain. And you know, it is so important to the strategy and to the response. And frankly speaking, we have been able to project, to predict, to recommend, to advise the government and the country on the information because of the data. And the data starts in the field. So, as they say, big up to our healthcare workers at all levels and the information that is provided. Important to the response of COVID, of course, is the vaccine supply situation. And you would have seen in the media space the National Health Fund, which is an agency of the Ministry of Health and Wellness, which was given the responsibility, working with Ministry of Foreign Affairs and Foreign Trade, Minister Johnson Smith and her team, as well as our team at the Ministry, PSCMO and others, to secure vaccines. We were concerned, and I have said it, that April would have been a difficult month, given all that has been happening re the vaccine availability because of the shortages in supply, high levels of demand, and the temptation and indeed the follow-up action by countries that have the vaccines in their jurisdiction to hold on to what they have to protect their own population. So it was a big concern, but I am relieved to say that with the efforts of the NHF, Mr. Mitchell and his team, Everton Anderson, and the rest of us, we have been able to secure some vaccines starting as early as this weekend. And this is really good news, very, very good news for us. And I really want to say thanks to all those who have been involved. So we have 75,000 doses of AstraZeneca from the African Medical Support Platform. And that should be, if not already, in transit, moving from all the way across the world to the Caribbean, to Jamaica. And then we have another 20,000 doses of the Moderna, which we have sourced through some other commercial arrangements. I don't have the specific details on that, but very welcome. This Moderna, this is the first Moderna branded that we would have gotten. And then we anticipate, based on information we've received from the COVAX facility, the WHO supported COVAX facility, a 26,000 dose of AstraZeneca, which hopefully will come to us sometime in the early April. These shipments should ensure that the government's ability to administer vaccines as a very important part of the response continues, and we are hoping that we will see or realize these doses, this amount, in over the next, which will allow us to continue the program over the next, I would say, 4 to 6 weeks. And during that time, of course, we are aggressively pursuing other sources, and we have expectations to be supplied through the contracts or the agreements that we already have, in particular COVAX and also the African Medical Support Platform. The truth is that in the next couple of months, I do expect that the market for vaccines will free up a bit as countries that have been able to hold on to what they have because they have the production base or the manufacturers begin to provide sufficient to their population as they struggle with vaccine hesitancy, as we will too. You're going to find that they are going to have to stockpile. And my anticipation is that you will soon see more vaccines on the market, reliable and safe vaccines, and maybe even some gifted to us, which we will appreciate based on relationships that we have forged. So a lot of those efforts are continuing, and we will keep the public informed. But for the time being, I think we're in a good position, given what we have and what we expect in the short term. So we have completed 3 weeks of the vaccination program, and on Wednesday, March 31st, 2021, we have inoculated 41,901 persons in Jamaica, and have received the first dose of the COVID-19, who have received the first dose of the AstraZeneca vaccine. In week 3, we reached 53% of our target of the 19,580. We are at 10,307. There are many reasons for that, and we can go into that if necessary, but nevertheless, our total is 41,900 as of Wednesday. So far for week 4, we have vaccinated 2,254 persons of the 9,447. So we're at 24% of our target. The overall vaccination number represents, this is a 41,901, represents 88% of our target for the month. So we are 88% of the target for the month. The upcoming vaccination sessions for this week, we continue with members of the population 75 years and older. So that's our focus, and that's what the registration process, which we announced, the online and call-in, as well as through the NHF and the health centers, that's where they're going to place the bulk of their focus. We've seen some responses, but we would have liked to see more. And so we are deploying other methods to try to get the 75 years and over out. The obvious rationale for that, the older you are, the more you have comorbidities, the more you're likely to end up in the hospital, and the more you're likely to die if you have COVID-19. And the evidence bears that out very clearly. So we're offering protection to that population because they represent the most vulnerable. Those age cohorts will be adjusted, and perhaps as early as next week, depending on how we go through this weekend. So the public should stay tuned for additional updates. And like I said, it could be as early as next week. Members who are coming to the to benefit from the vaccines must remember that the appointment system is the preferred option. Once you visit the site where the vaccine is administered, you should present your government-issued ID or a letter from the Justice of the Peace, and we will proceed, having given you a time and date, once you are registered, to apply the vaccines. In addition to the 75 and over, we remind our healthcare workers, JDF, JCF, and government officials that you are, having started already, are all entitled to get vaccinated if you missed your initial focus period. So 75 and over were the others who had initially qualified. For the second national vaccination blitz, will take place on Saturday. That's April 2nd, right? Today is the 1st? 3rd. Today is the 1st, 2nd, 3rd, yes. April 3rd, this Saturday. And this Saturday, we have deployed a different strategy, which I'm going to ask the PS to go into details on. Are you planning to do your presentation, or should I just expound on it? All right, so this vaccination blitz on Saturday will involve all that took place last Saturday, except an additional variable which will seek to respond to the hesitancy of that age cohort by deploying and coordinating with the political organizations in the respective constituencies across, in this initial instance, across 5 constituencies in the corporate area. So we are working with Members of Parliament Philip Paulwell, Members of Parliament Julian Robinson, Member of Parliament Angela Brown-Burke, Member of Parliament and Minister Desmond McKenzie, and MP Williams. Central Kingston, MP Williams. So what we have done is basically chosen 5 catchment areas, if you will. And we are working with the MPs and their organization, and they have an organization on the ground that has served them well. Clearly, they are members of parliament. They have been elected. With the electoral office to provide information on persons who fall in that age cohort, and working with them to give support, whether through town criers or mobilization support, to identify persons, but not just to identify persons, but to use that organization and the influence of that organization to convince persons on the value and the importance of coming out. So there's a little reasoning that have to take place. And one of the things that we've tried to do is to provide that support. Now, it's a template that we're trying. I know sometimes many persons are impatient that we need to move faster, but we don't want to roll out and create chaos. We want to be gradual initially and then expand exponentially across the country, knowing that the formula can work once we all understand it. And we believe that this new approach of embedding the leaders, the political leaders on the ground, giving them support, helping them to identify these persons, and encouraging them to encourage these persons to come out. We'll be interested to see how that works. Now, we're not doing that just with political representatives. I've had meetings with the church, the umbrella church groups, the leadership. We've encouraged them to help to register their members who fall in that age cohort, and I know a number of churches are actually doing that. We have dealt with the senior citizens organizations. So it's not confined to one group. It's an attempt at building out a structure, an organization that can mobilize a population. As I had said in the early stages, that this vaccination exercise that we're embarking on is perhaps the most significant national mobilization program, only compared perhaps to an election day activity. And clearly it's different because one is over a period, another is on one day. But what it means is that we have to, if we are to get to that 2/3, all hands have to be on deck. And there's no difference in political colors or persuasions. If you notice, we're working with everybody. And this is not, because we're using the political organization, doesn't mean it's a political activity. It is a national unifying activity that is intended to save ourselves and our country and restore normality as quickly as possible. Vaccines work, and we have to convince persons to come out, and we have to help those who can't help themselves to come out. And our senior citizens and the most senior needs the support. And so we're working with the church, the political representatives, and others to help to get them out. So Saturday, April 3rd, we will execute the second blitz operation with those changes. It will be at the National Arena between 10 a.m. and 3 p.m. We are still aiming for the 1,000 persons, but the 5 constituencies or MPs I spoke of are being asked to try and target at least 100 persons 75 years and older to get them registered and to assist with their logistics or movement to and from the location. And they've all said that they will embark on that. We intend, having assessed that process, to roll that out across the country. And we have identified a number of sites for is it the 9th of April? 10th. The 10th of April, when we intend to have a national blitz, meaning on that particular day, the Saturday, where we will tweak what we have learned from these 2 exercises, last week and this week, and finalize a model, and then roll it out nationally, at which point we expect to inoculate multiples of what we would have done. And then we'll continue to do that and hopefully just keep refining it to get it right. So this Saturday, 10 to 3 p.m., National Arena, focusing on 1,000 persons. All are welcome who qualify to register online. Go to the ministry website or call the 888 One Love number. But we will also be aided by our political representatives and others to play an important part in getting the team. I want to thank those who have been involved in the organization, the permanent secretary who has been sort of the CEO of the COVID vaccine plan, and of course supported by the JDF and the JCF, the Regional Health Authority, and the clinical team. I think last week they did a very good job, and we have to commend them for that and encourage them, because we have quite a few more activations to go. I think that's... Oh, Dr. Ennis is online. Okay. I think that's it for me. Dr. Ennis, would you like to add anything else in terms of the vaccine plan?
No, Minister. Thank you very much. Good morning, everyone. I believe you have covered most of it, and you did, Minister, give details of the percentages of persons vaccinated. I only need to say that as we continue to look at the figures, we notice that more females are taking up the vaccine offer. That was expected, especially in the group with the healthcare workers. However, as we expand it to the other groupings, I am encouraging our males to please access, come on board and receive the vaccines. Looking at our numbers, we know our men, once they get COVID-19, they don't necessarily do well. So that's my encouragement to the population at large. For those in the requisite age group now, males, please come out and get vaccinated. Thank you, Minister.
Okay. I think that's it. I think that's it for now. Let's go in the questions.
Thank you very much, Minister. Just reminding our media colleagues to use the raised hand feature on Zoom to pose their questions to the team, you can do so now. Okay, we're going to begin with Kate Chaplin from Reuters.
Yes, good morning. You can hear me?
Yes, go ahead, please.
Yes, good morning. Why were some LAC states like the Dominican Republic and Chile able to secure at least 50% of the vaccines they needed, while Jamaica secured only a fraction needed? And I'm wondering, was it because the new budget bill had to be passed? And if so, was discretionary spending considered to cover the cost of pre-ordering?
I can't speak for other countries. I'm not sure what arrangements they may or may not have had. I can speak for Jamaica and our policy. Firstly, that budget was never an issue as it relates to securing vaccines. The government had signaled its intentions from early that it would make the necessary budgetary arrangements, and indeed, those arrangements were announced. We have been guided by the approach that have worked for us in the past around immunization. We are very active and have benefited significantly from our immunization program, where we vaccinate based on approved vaccines by the World Health Organization and are guided by that body and similar bodies, PAHO and others, as it relates to how we approach our immunization program. So in our case, we signed on to COVAX. Commitments were made around the numbers. In fact, we were told initially, and I did go to Parliament and announce that we would have gotten between 150 to 250 doses of vaccines by the mid-February. And that was a written communique from the COVAX facility. I know you keep in touch, so you would have seen what happened since then, the raging debate around vaccine nationalism and COVAX being undermined or not being able to deliver based on those numbers. So if that facility had worked out, then we would have had a lot more vaccines. The same situation would apply for the African platform. And as a consequence, those arrangements and the disruption in vaccine supply based on supply and demand forces delayed the arrival of vaccines. You add to that the policy of the government to accept vaccines that are approved by the WHO, which would have gone through all the clinical trials and sign-off, then it explains, to my mind, why we are going at the pace that we are going. Having said that, I do believe it will become easier in the months to come because I believe that more vaccines are going to be approved and we will see greater supply in the market. So I'm not worried at this point in time. I think the pace will be stepped up in the next month or two.
Thank you very much, Minister. I think that's all the raised hands we're seeing for this morning. So I'm just going to hand back to you for your closing remarks.
Okay, so I know this at this time of the day with the long weekend approaching and the shutdown tomorrow, many persons, I hear the traffic is heavy on the outside. I just want to use the opportunity to again wish all a holy, peaceful, and reflective Easter. I want to encourage you that you maintain the protocols during these few days, the mask wearing, the sanitizing, the physical distancing. It's important because, as the CMO said in our presentation, we are benefiting from what appears to be a plateauing of the rise in cases, the productivity rate, even with the hospital rates. And so we are hoping that this weekend and the measures that have been imposed will lead to a further fall, and then hopefully we'll be back in more comfortable territory even while we roll out the vaccine plan. So please make this a restful period, and remember, the reason for the restrictions is for the threat to be lessened. So do what you can to play your part. Having said that, I think a little bun and cheese is in order, as long as you walk it out the week after, right, CMO? I'm sure. Right, PS? Not really, okay. Enjoy the season, and let's give God thanks for life and give support to those who unfortunately would have lost a loved one in the last year. Thank you.
This morning I woke up and I looked in the mirror and every part of my body was in place. Many people died and never saw this day. So another day I live, I appreciate. Don't ever wanna act too high and mighty, cause tomorrow I can fall down on my face. So in everything, Lord, I give you praise, and that puts a smile on my face. Lord, I thank you for sunshine, thank you for rain, thank you for joy, thank you for pain. It's a beautiful day, beautiful day, beautiful day. Don't fuss and fight, let us unite. We got one life, so let's it's a beautiful day, yeah. It's a beautiful day. Shadows of death, I will fear no evil, won't be dismayed when I see the clock ticking away and things are not in place. Everything in life happens for a reason. Disappointment comes with a lesson. It's for me to get wiser, got to work harder. In the end, it will get better. Lord, I thank you for sunshine, thank you for rain, thank you for joy, thank you for pain. It's a beautiful day, it's a beautiful